Good. How are you?
Hi. Fine, thank you.
Yes, we're in Washington, D.C. attending this large, important conference.
I am, yes. For many years now. Yeah, almost 20. Well, I was diagnosed with HIV in 1988 when I was 19 years old, and I quickly found myself in a position of keeping my HIV status a complete secret, and after quite a few years of carrying that burden and the stigma around, I decided to go public with my status and got the opportunity to start speaking up for other people living with HIV. So I've been very fortunate. Absolutely, absolutely. Every forward movement with the research that we make is important to all of us living with HIV.
Well, this study, which was a groundbreaking study in terms of treatment for patients that were first diagnosed with HIV and going on their very first treatment cocktail, if they took a treatment combination that included ISENTRESS, they had a reduced virus in the blood that was very comparable to the combinations that are used as a standard of care that includes Cystiva. And with the added advantage that they had a reduced side effect profile, as well as the fact that they had an increase in immune system fighting cells that were seen beyond what was seen with the standard of care. Well, I think that for patients living with HIV infection, it provides a lot of hope in that if patients are going to be considered to be starting on the very first treatment regimen, if this drug gets approved for that indication, in other words, if it gets approved for first-line therapy, they have an added option. And patients that are going on treatments always need options because every patient's different, and we need to individualize care for each and every person. Yes, they are. And they're looking at a wide variety of individuals, individuals that are of minority populations as well as women. And yes, they look at a large variety of individuals. I do. I mean, this medication that was studied here, ISENTRESS, is a perfect example of how the technology has moved so much forward. This medication, ISENTRESS, has a unique mechanism of action because, as you mentioned, you talked about DNA. This medicine actually stops the virus from integrating itself into the host or human DNA in the core or the nucleus of the cell, which is very novel and very different than any of the antiviral drugs that were ever used before.
Sure, absolutely. Yeah, I think over the last 20 years, we have seen just enormous progress. And ISENTRESS is a great example of a therapy that has come out of 2 decades of really hard work and focused effort on behalf of the basic science and clinical science community. So I think the research has been really great, and it's always good news for people living with HIV when more treatments become available.
NorthStar Healthcare is actually the largest private HIV treatment center and research center in the greater Chicago area. We take care of over 3,500 HIV-positive individuals, and we've conducted studies in just about every medication that's ever made it into our treatment armamentarium over the years. And we've done many studies with medications such as ISENTRESS. And this provides access for our medications, and it helps for people overall to learn about how some of these medications get used, and in terms of getting some of these medications to the market.
I haven't gone to NorthStar. I actually don't live in the Chicago area, but I'm already a big fan of Dr. Berger, so.
Yes. Absolutely.
You're welcome. Thank you. All right. Bye-bye.
Bye-bye.